Dr. Zorba Paster is here this afternoon. We're taking your calls at 270-9933. Hi, Zorba. Good to see you.
Here. Good to be here.
Good to have you in the studio today.
Yes, happy holidays.
To you as well.
Lighting up for you.
Yeah, I know. The phones are very busy, so let's get right to them. And we will start with Karen in Cottage Grove. Hi, Karen. What's your question?
Hi, my question is if the doctor is familiar with the success rate of a spinal cord stimulator?
Sure. Well, spinal cord stimulators are used for people who have severe pain. Either they cannot tolerate medications or the medications just aren't working for them. And they're put in by a company, Medtronic, the same company that makes cardiac devices that are used, ICDs and other devices like pacemakers. For some people, they can be very successful. For others, they don't do anything. And the real issue is having a physician knows how to use it, like in Madison, the university, other places know how to do it, and sometimes it can be very, very successful.
Okay, so for Karen, it might be something that's worth a try.
It might be something that is useful.
All right, our next caller is Julie from Madison. Julie, what's your question?
I want to know how you can tell the difference between this really bad cold going around that mimics the upper respiratory flu from the real respiratory flu.
So you mean real influenza?
That is such a good question. Everyone is battling that right now.
And basically, the viruses that are in right now, there's not much influenza around. It is around, but it's not really much around right now. And sometimes it's not that easy. In your doctor's office, you can actually do a test to find out if you have influenza. But for the most part, if you've gotten your shot and you're not feeling really awful, it's probably not influenza. And that's kind of what it is. There's no absolute thing with that test.
How long can it last?
Too long. That's how long it lasts. It can last for a couple of weeks. These respiratory viruses are just awful. They just hang on.
Oh, well, hang in there. You're not alone.
Right.
Everybody
Not
is
alone
going
at all.
through that today. Let's go to Dorothy in Madison. Hi, Dorothy. What's your question?
I have real oily hands. It feels like I just took them out of a jar, and I can't find any way of getting rid of it.
Sure. Do you sweat also? Do your hands sweat?
No.
Okay. Well, one of the things you can do, there's something called dry sole. We use it for sweating, but it's also something that can also be used for oily hands. You put it on your hands. It's kind of like a super hot perspirant, but the reason why sometimes it works is it just changes basically the glands in your hand and the things around there that actually produce the oil. So I would try that if soap doesn't work.
Because I've tried everything, and doctors don't know what causes it.
I don't think we know what causes it, but I'd go and try dry sole is what we use for overall sweating. That might work for your hands.
Okay. All right. Very good.
And we have Tim from Wanakee. Hi, Tim.
Hello.
What's your question?
My question is my PSA jumped up to 5.25 after being about 2 or 3. My doctor said wait a couple of months, do another one, and see how that turns out. Dr. Zorba, have any more advice?
Good idea. I think that's always good. PSA tests are for prostate cancer. A lot of other things will also produce an increase. Prostatitis will do it. Sometimes a random variation. I think if your doc recommends repeating it is a good idea. You don't have to jump necessarily to a biopsy right away. PSA test is the most controversial test in medicine. Repeat it.
Okay. All right. Very good. Thank you for calling today. Let's go to Donna in Monticello. Hi, Donna. What's your question?
Yes, the pituitary gland, what am I up against?
Well, what's your problem?
Well, they don't know.
Well, first of all, pituitary gland does a lot of things. It can produce excess in prolactin. For a woman, it can mean that there may be some discharge from her nipples, which can be milk. And I think looking at it, MRI scans, CAT scans, blood tests allow you to determine whether or not anything can be done or should be done. And that's where you need a good endocrinologist.
Okay.
Okay. Thank you.
All right, thank you. Thank you for calling today. Unfortunately, we're out of time, but thank you, everybody, for calling. We've got a lot of calls in today, Zorba. Good to see you.
Happy holidays.
Happy holidays to you as well. We'll see you next time, and we'll be right back.